Life for a transgender woman in my community, Tanzania. Tanzania is, a lot of people from Tanzania are traditionally inclined and religious inclined also. So we are always stigmatized, we are always discriminated against. So you can never go to church without becoming the topic of the day.
As a trans woman, this is what my life looks like. So living in the area that I do, things are rather problematic because people have no understanding around who I am. But it's not the fact that they don't have an understanding, it's the fact that they have no knowledge around the language of trans people.
As we are transgenders, our parents and our society, they've got expectations because they expect you, since they know that what gender you assigned at birth, so they expect you to do the man chores. Instead, they bring violence to you once you wear dresses, all that stuff.
From an early age, it was never easy. When you had to walk the streets, people had to come at the back of you and they had to, they would call you names and all that. Even though life is better now here in this community, there's still a lot that needs to be done here. So it's never an easy situation, and you can never tell if you are safe in this community.
I know that as a trans woman from East London, there are many social determinants that we face that are very harsh, like access to treatment, access to gender-affirming services, access to justice.
Eastern Cape is more attached to a culture and religion. So that thing, it suppresses us as how we are feeling. So you can't just say, if you're coming from a saved family, so you can't just say, Mama, I'm a trans and I feel like wearing a dress, and then you can get kicked.
Regardless to what you expect, the business, it's about two people. We are negotiating what we're gonna do. Somewhere, somehow, there's a changes, as you said. Maybe it's gonna take the force, a service by force. That's what I'm going to say. So, if I'm going to the police station to report a case, sort of like that, they said sex work, it's not legal. So I can't do otherwise, regardless to it.
The research that is undertaken through this study is critical for us because we have to bring that back to the social dimension of our lives, right? Because it's those social factors that make us vulnerable to HIV.
This would actually be a breakthrough. Seeing that the study is not just a study that's going to be documented only on documents, that it will be a study that will be screening people, because as trans women we are even like, there's even this saying that says that 9 out of 10 trans women would not even access healthcare facilities even if they are sick. So going to them actually is like bringing the service to them and screening them for STIs and HIV. So the study is actually going to be a breakthrough for trans women in the Free State, and it will really help them, to know at the earlier stages if they should take their ARVs, if they should go to the clinic and access the fact that they've got STIs. Because so most of us are actually living with untreated STIs, and we don't even know that. And we are trying, and even though we get STIs more often, because we're using condoms, but now we don't have access to lubricants. So it's like we are putting ourselves at risk still.
This here is a trans woman, not a Mufi, not a Stabani, not things like that. So if you want to know more, then let's chat. If not, you have the freedom to decide exactly what you want to do. So yeah, let's speak the truth here. Firstly, there will never be an ideal world. But if there would have been an ideal world, this is exactly what I would want. So I would just want to be okay. That is all. Nothing else. I would just want people to respect me for who I am.
This study to me means that our issues get recognized. Also that there could be a change in terms of economical empowerment, because a lot of transgender women aren't employed out there.
I just want to say thank you so much for the study, and I believe and I actually encourage every trans woman out there to be involved in this study and to recruit more trans women to actually be involved in the study, as this study is going to be a breakthrough for us as trans women. This is an opportunity for us trans women. Let's use this moment and let's engage in the study.